Today we will be performing ultrasound-guided transforaminal epidural injection with subpedicular approach and confirmed with fluoroscopy. First, we will see the anatomy and how is the probe position in a volunteer, and then go to actual procedure.
I'll be holding the probe here for the transverse process, and then gradually and this is much deeper. You see, the transverse process, these are the articular process, superior articular process, inferior articular process. They are much more superficial. So when I'll be holding the probe over here and gradually sliding the probe towards the midline, I'll see the articular pillars, and this projected part of the articular pillar, this part is known as the mamillary process. This is the mamillary process. Okay, and then still you are going medially, and you'll be seeing this, the articular pillars. This is also known as the camel's hump view because it looks like a hump of the camel. And then still you are going medially, you'll be seeing the interlaminar. So between the two lamina, there are acoustic window through which you can see the spinal canal.
So this was the transverse process. If I'm going more medial from here, suddenly the bony projection is coming. So this is your what?
Articular process.
Articular process, or also known as the camel hump view. So this was your transverse process, and this was your mammillary process. This process is mammillary process, right? Mammillary process. Yes. One mammillary process, another mammillary process. Now here we have one very important option to do the transforaminal epidural. So after you are getting the mammillary process, fix the lower end of the probe, and upper end of the probe I am coming back to the transverse process. See, this is the transverse process. So left hand side is your transverse process, right hand side is your mammillary process. Transverse process, and this is your mammillary process. Because mammillary process is articular pillar, so that is much more superficial. The transverse process is deeper. So here is your nerve root. This is your nerve root. So your needle can come like this, and you can give in plane transforaminal epidural injection. And you can see the blood vessels also in front of the mammillary artery. Nerve root, there is a blood vessel as well.
Now we will see how to do the block in real time. First, the ultrasound probe is placed over the transverse process in a parasagittal orientation. From this position, the probe is slowly moved medially until the mammillary process is visualized. Then probe is slightly tilted so that one end of the probe remains over the transverse process and other end over mammillary process. After confirming the sonoanatomy, a needle is introduced in plane with the probe. The needle is advanced under real-time ultrasound guidance, carefully directing it toward the target nerve root in the intertransverse region, while continuously visualizing the needle tip. We confirm the position with fluoroscopy. Needle is exactly in the subpedicular region, which is perfect to block the exiting nerve root. On this fluoroscopic view, the transverse process of L5 appeared unusually enlarged and was articulating with the sacral ala. This represents a lumbosacral transitional vertebra, commonly associated with Bertolotti's syndrome. After giving the contrast, we can clearly see the exiting nerve root. In lateral view, we can see needle is exactly at the entrance of the foramen and contrast in spreading across the epidural space. We gave steroid after adequate confirmation and removed the needle and sterile dressing done.